before the treatment it would be a 1, and
Okay.
after the treatment it would be about an 8.
Okay. Okay. In terms of what provokes the pain, what would you say provokes the pain? And can you also say what the level of intensity on in terms of provoking the pain is?
Well, in terms on scale of 1 to 10, with 1 being the highest and 10 being the lowest, then when I have lifted heavy weights, or when I have twisted my body, uh, the pain level has been a 1. And after the treatments, it's been about an 8.
So, also, in terms of activities, what seems to exacerbate the pain in terms of activities?
I would say being tired. If I don't get enough rest, then I feel the pain when I walk fast. If I twist, if I lift heavy things, I feel the pain, and it's more painful when I don't have rest, and it's also more painful when I wear a back brace from time to time, and when I do that, it helps keep my body in alignment.
Okay, thank you for sharing. In terms of the quality of the pain that you experience, what do you think, what is your perception of the problem based on your understanding of the explanation from the primary care physician regarding your MRI and revealing that a degenerative disc disease is present?
I would say that the most prevalent thing now is the fact that I have compressed discs, so that without doing the stretching and strengthening my muscles, the sciatic nerve is going to be pinched, and there's no getting around it.
How does that make you feel?
I'm very cautious, much more cautious now about lifting, going up and down steps without holding onto the rail. My balance is not good, and I just have to watch everything I do, and I can't do heavy lifting anymore. Period.
So you can't do heavy lifting and you're cautious about making sudden twisting movement.
Yes.
Understood. With respect to your past medical history, what type of major illnesses have you experienced during your span of life?
Well, I have type 2 diabetes, which I was diagnosed with in November of 2011. I had a mild heart attack in January of 2013, and beyond that, I was diagnosed with prostate cancer in April of 2017. And that's pretty much what I have right now. I mean, I've broken limbs before. I'd had a tonsillectomy when I was 7 years old. Didn't have anything to say about that, but it was something easy for the doctor to do. And Mom, being a nurse at that same hospital and knew the doctors, that's what they worked on. So, hey.
I hear you. So the injuries in types of fractures, where were they?
So I broke my right arm in 1984, just below the shoulder, and I slipped and fell at a water park, and my elbow hit the pavement, and it drove the arm up about 5/8 of an inch,
It must have
and
been painful.
the bone splayed out.
Wow.
They call it an explosion fracture, and it took months to heal. Fortunately, no muscles or veins were torn or affected. The muscles healed. The veins, the arteries were intact. But it just it took a long time for it to heal. And I broke my left arm just below the shoulder. And on the X-ray, it looked like a pizza that had been sliced. That didn't take as long to heal, and it was a clean break.
So when did you break your left arm?
I'm going to say about 1997, several years after I broke my. Okay, the right arm was 1984, left arm was 1997.
How many times were you hospitalized? Well, you can start by describing or explaining if you were hospitalized for overnight or inpatient.
Okay, well, I was hospitalized when I had my tonsillectomy. I honestly don't remember how long it was. They were feeding me ice cream to help calm the pain, and I did have doctor's visits at home, so I know that I wasn't in the hospital that long. When I had my mild heart attack, I was in the hospital overnight for observation, and after they put the stents in, which was a day later, I was in the hospital overnight for observation as well.
So
yeah.
one night for observation and one night to put the stents in.
After the stents were put in, I was held in the hospital for a night, and when I first was complaining about the heart attack, the pain in my chest, they checked me to the hospital for one night.
When were you complaining of a heart attack?
I was it happened on a Monday. I was feeling pain in my chest, and so I went to the hospital. My wife drove me to the hospital, and they checked me in right away. They had taken blood, and the troponin level was elevated, but they wanted to see if it was going to go down or go up, and so they put me in the hospital for observation. And they drew blood every 4 hours, did the test, and the troponin level kept increasing. So they moved me to a different hospital to have stents put in my heart.
Thank you for sharing. Do you remember the year?
That was 2013, January of 2013.
Thank you for sharing. In terms of the following childhood illnesses, have you had measles, mumps, rubella, pertussis, and strep throat?
I would say I've had everything, every one of those except the one that causes herpes.
Thank you for sharing.
I don't know which one that is. I can't remember which one that is, but every one about that.
I believe that's the chicken pox one.
I didn't have chicken pox.
Okay. In addition, what type of surgical history have you had? I know you said you had a tonsillectomy in 1953, and an inpatient stay in 2013 for cardiovascular stent placement.
That's correct.
Was that for a total of, how many days was that?
Well, combined, I would say between the two, I would say probably about 3 days.
Okay. In terms of obstetric history, that doesn't apply, and I agree that that doesn't apply, and I'm sure. What is your statement?
And, obstetric treatments don't apply to me.
Thank you. And
I do have 2 children, but beyond that,
okay. What type of immunizations have you had?
whatever was called for, I had them, and I'm current on all immunizations.
Okay. What about in terms of psychiatric history during childhood and adulthood?
I haven't had any treatments whatsoever for psychiatric reasons.
Okay. Okay. What type of allergies would you say that you've had?
I'm allergic to sulfa drugs, and I'm allergic to grass, and dogs and cats, and that's about it.
Okay. What type of allergic reactions do you have to sulfa drugs and then to sulfa drugs?
For sulfa drugs, my reaction is that I have had the anaphylactic shock, various symptoms of that, and it gets progressive. For the allergies to grass and to cats and dogs, I get hay fever, which is sneezing and watery eyes, and I can't stop without taking some sort of a sinus tablet to dry up.
Okay. What type of medications, prescriptions do you take?
I take prescriptions for diabetes. I take metformin, 1,000 milligrams twice a day. Januvia, 50 milligrams twice a day. Farxiga, 20 milligrams once a day. For the heart attack, for the stents, I take 20 milligrams of Lipitor once a day, and I take what they call baby aspirin, 81 milligrams of aspirin once a day.
Okay. Do you take any over-the-counter drugs or herbal supplements?
No.
Okay. Excuse me. When was your last examination? The date of the physical examination, for example. Excuse me.
I'd have to look. I can't recite all of them.
Okay. Well, let's start with a physical examination. When was that?
I had a physical exam.
That's okay. You don't have to have the exact dates.
My last physical exam was in 2021.
Okay. In your eye exam?
My eye exam, I just had one recently, and that was in April of 2022.
Okay. And EKG?
That was in February 22.
Okay. And the chest x-ray?
Chest x-ray was a year ago in 2021.
Pap smear is not applicable, or a mammogram. What about serum cholesterol?
That I had done just recently, so that'd be in April of 2022.
And have you had an exam for stool for occult blood?
And that was in April of 22 also.
prostate exam?
I had a prostate exam in February of 2021.
PSA, prostate specific antigen.
I had PSA in June. The last time I had it was in June of 2021.
A urinary analysis.
April of 2022.
Okay. TB or skin test was not conducted as
Haven't had that in years.
What about health maintenance tests, such as a dermatologist appointment?
I did have a dermatology appointment in 2021. Can't remember which month.
And so it would be, would you say it would be the spring or the fall?
For the dermatology, I would say it was probably late spring, early summer.
Okay. And the year would be 2021. Thank you.
Mm-hmm.
With respect to medical appointments for children, such as sickle cell anemia, PKU, lead level, and hematocrit. In terms of your family history, can you list your family history in terms of your father and his status, whether he's living or deceased?
My father is not living, and I don't recall what his illnesses were. My mother had a history of heart disease and diabetes. My grandparents, I don't recall what they had. My grandparents are not alive. Neither parent is alive at this time.
Okay. With respect to your spouse, are you aware of what types of diseases your spouse has?
Well, I would say probably hypertension, obstructive sleep apnea, she has an atrophied kidney. I would say there's probably some, she's being seen by a nephrologist. She's checked for cardiology because of high blood pressure. And that's about it.
With respect to your living children, are you aware of any diseases that they have?
From what they've told me, my daughter is she doesn't have any major illnesses whatsoever. My son has disability with he has a bone disease that's rare. I can't even name it, but he's had it for years, and he has a pain pump installed along his spine, and it's continually degenerative, which means that it's progressive. I'm just thrilled that he's still alive.
Thank you for sharing. So your spouse, is your spouse deceased or living?
My spouse is living,
And
and I'm in a heterosexual relationship with my spouse.
okay.
We're in a very committed relationship.
Thank you for sharing. In terms of lifestyle and partner, what is your immigration status?
I'm not an immigrant. I was born in Los Angeles. I'm a U.S. citizen by birth.
What is your spiritual or religion?
I'm a Christian. Specifically, I'm a Seventh-day Adventist.
Okay. What about your health perception? What would you say about your health perception?
Yeah. I feel that on an overall basis, considering everything, that my health is, I'm moderately healthy. I don't have serious symptoms in terms of diabetes or the vascular cardiography or cardiology. Prostate cancer, I've been diagnosed with it. I don't have any symptoms of it currently. And so, above average.
Okay. All right. You're under your physician's treatment for prostate cancer.
Yes.
Okay. With respect to your nutritional patterns, what type of diet do you eat, and what type of appetite would you say you've experienced? Any appetite changes?
Huh. So, I have tried to be a vegetarian, and I prefer being vegan. I prefer organic food over non-organic food. I don't eat meat. I do eat dairy products. I do eat eggs occasionally. That's why I don't say I'm not totally vegan. I would say I'm probably 95% vegan. And I prefer to have organic food.
In terms of your weight status, what is your current weight, and what are your desires with respect to weight?
My current weight is, in round numbers, 200, and that varies up and down by 2 or 3 pounds. My goal is to be 165, so I really want to try to lose 35 pounds.
Do you have any recollection of unusual dietary intake?
Well, such as what, alcohol?
Anything unusual?
I haven't drunk alcohol at all.
Okay.
I used to smoke tobacco. I quit in May of 1980.
Okay.
I no longer have a desire for cigarettes. I don't need alcohol because I get enough sugar, which metabolizes to alcohol. I haven't used non-prescription drugs.
Thank you for sharing. Do you have any cultural restrictions or any aversions to certain types of foods?
I have, I don't eat meat. I used to eat, I would have ground beef hamburgers. But I prefer not to eat meat at all. That's not necessarily a religious restriction, but I do not eat seafood. I do not eat pork. I will eat occasionally. At Thanksgiving time, I'll have a bite of turkey.
Okay. What? How would you describe your fluid intake? And
I try to drink a gallon of water every day.
okay,
Now I count. I drink tea, and I count that as water as well. So between that and distilled water, I drink a gallon.
okay. What type of bowel or elimination pattern would you typically describe yourself as having?
I would say I don't. Well, let me say this: I don't get diarrhea or constipation. Typically have a bowel movement about 3 times a day, and usually about the same time, give or take a little bit every day. And why those particular times, I have no clue. What I would say is 9 a.m., noon, and midnight. Other than that, I'm good to go.
Okay. Um. Okay. What about your urinary patterns?
Nothing unusual. I empty my bladder about once every 2 or 3 hours. When I wear the back brace, it pushes on my lower abdomen, so my bladder doesn't hold as much.
Would you describe yourself as having any periods of incontinence?
No.
Where would you describe yourself as living? Would you describe yourself as living in a rural community of the suburbs, or
I would say suburbs, relatively close to a city. It's a development that was built up several years ago. It's a quiet neighborhood, no farmland close by. Well, there is some close by, but not in this community. And when I drive to the store, I'm like 10 minutes away from the store.
okay. Okay. What is the state that you live in, and the type of what type of family dwelling?
Okay, so live in Maryland, state of Maryland. And the dwelling is a single family dwelling, as
Thank
opposed
you.
to a townhouse. It's a single family dwelling.
Okay. Do you have any knowledge of known exposure to environmental toxins at home?
To my knowledge, no. No exposure.
Okay. Do you have any knowledge of known exposure to environmental toxins at work?
No.
Are you, would you describe yourself as being fully functional in terms of paying attention to activities of daily living, otherwise known as ADLs?
I don't have any abnormal activities that I'm aware of.
Okay, so you are fully functional. You would shower and bathe by yourself. You don't need
Yes.
assistance.
I do not need
Okay,
assistance.
so you are independent in terms of activities of daily living habits,
Yes.
or IADLs, interpersonal relationships and resources.
Yes.
Thank you for sharing. What do you believe your immediate role is in terms of family relationships and immediate family composition?
Well, the children are grown and gone. I characterize my relationship with the family as the patriarch of the family, and it's my responsibility to provide for the family and protect the family.
Thank you for sharing. What type, in terms of making family decision, how would you describe your family decision-making process?
Well, my wife and I consult and discuss everything, and we do reach agreement. And pretty much on that basis, we do reach agreement. We discuss until we agree.
Sounds great. In addition, what is the impact of each family member's health on the family in terms of being interrelated? How do they affect the day-to-day challenges? How
Well,
do you see
with the children being adults living on their own, in terms of the family, it's we're dealing with my wife and myself, and I don't think that we don't have any debilitating serious injuries that keep us from working.
Okay. So what would you say the impact of each family member's health would be on each family member? How would that?
No, that's a tough one. The children are grown and gone. When they were growing up, they didn't have any serious illnesses. Usual stuff. I would say overall we've been quite healthy.
Okay. What about your cognitive function, your memory and judgment? How do you feel about that?
Cognitive. So I have a pretty decent memory.
Mm-hmm.
Not perfect, and but I haven't forgotten everything.
What about your speech and your memory? Your speech and judgment, rather. I apologize.
Okay,
And senses. Speech, judgment, and senses.
Well, I would say that my speech is normal. I'm relatively intelligent,
Mm-hmm.
and I can carry on a conversation. I try to keep my opinions to myself. However, if somebody asks me a question, I don't mind giving them my thoughts on the matter. I like to plan ahead. I like to budget the finances, and when we come to trip planning, I plan the trip very carefully and make sure that we can afford to go where we need to go and still have some money when we get home.
That that makes perfect sense. What would you describe as your sleep pattern on a daily basis?
So I sleep anywhere from 3.5 to 5.5 hours at night. 3.5 minimum, and I have to take a couple naps during the day. And when I'm teleworking at home, which I've been doing for about 2 years now, I will take a short nap in the morning and a short nap in the afternoon. So totally, I guess I'm getting probably around 6 hours of sleep a day
Okay.
combined.
And when you sleep, what would you describe as the position of your sleep?
Well, because of my back, I lay on my back on a wedge with a pillow, and I've been doing that for probably about a year and a half, maybe 2 years now.
Do you have any aids for sleep?
No medication.
Okay. And what would you say your exercise pattern consists of?
Oh, it's not that great. When I walk to the bus in the morning and in the evening, when I go shopping, in the morning I take a bus. I have to walk from the parking lot to the bus, and then from the bus to the train, and from the train to the office. And I would say probably about maybe 20 minutes worth of walking total in the morning. In the evening, about the same.
Okay.
Mostly walking, not running.
Okay. And you had mentioned having aquatic therapy with a physical therapist.
Yeah, and I'm still doing some of that. Basically doing the physical therapy treatments, but in the pool. And so I'm not fighting gravity, and I'm able to stretch a little bit more. And when I come out of the pool after an hour in the pool doing the stretches, I hurt. But it's a good hurt, and within a couple of days, the pain goes away. And I tend to get stronger. I'm focusing on getting my lower back muscles stronger, so that they'll hold the vertebrae, the spine in place as well as possible.
Okay. And what type of activities do you enjoy?
In terms of what do I do with my free time?
Yes.
I like to read. I like board games. I like to play chess. I used to like to hike before I dislocated my lower back. So I don't do much exercising. I will read and I will watch sports on TV. I let Larry Bird do my basketball playing, and I let Tiger Woods do my golfing for me.
Okay. So would you say you would prefer to watch movies of these activities?
And I like watching movies.
Okay. Okay. We had previously discussed that you had discontinued smoking. And how long have you stopped smoking? And
Well,
that you
I quit in May of 1980. I had started smoking when I was 10 years old, and I quit when I was 34 years old. I quit in May of 1980, and I haven't smoked since then. I have no desire to smoke.
Okay. Do you drink and use street drugs?
I do not use street drugs. I tried them one day. I had a most serious reaction to it. I persuaded myself that I never had to do that again.
And you had stated previously that you do not drink.
I don't drink. I tried drinking when I turned 21. I didn't like the result. I got tired before it got funny, and so it just I didn't need to. I don't need to drink.
Okay. Have you ever been involved in intimate partner violence?
No.
How do you use your management techniques and strategies with respect to coping in stress?
Managing stress. Well, I will pray a lot for advice, for wisdom. I meditate, and pretty much try to think everything through carefully. And I try not to get into a stressful situation if I can help it.
Okay. Have you experienced any major stress or life changes in the past 2 years?
No.
Are you able, what do you think about using relaxation techniques and reality testing to relieve stress and tension from work, home, or from financial situations? What are the techniques that you would think about or using or applying there?
For managing stress in those relationships? Meditation, definitely. Praying for what should I do. I have a pretty good relationship with the Holy Spirit, and I get good advice.
What do you think about the use of humor or having a good sense of humor?
So, my philosophy is that we have two choices in life: laugh or cry, and then we die. And so you just put it into one or the other. And so I mean, you'll hear me laugh, or you won't hear me laugh. But I feel like I have a good sense of humor.
All right. You stated before that you, as far as your sexuality is concerned, you were, how would you describe that in summary?
Sexually, I'm in a heterosexual relationship. I'm in a committed relationship with my wife. And I would say that we are compatible, sexually compatible.
Thank you for sharing.
My wife takes good care of me, and I like to think that I do the same to her.
Thank you for sharing again. At this time, we will do a review of systems. What type of pertinent or negative and or positives experience do you go through on a general basis in terms of weakness, fatigue, or fevers? In terms of weight loss, have you experienced weight loss or weight gains? Weight loss or weight gain? Have you experienced anything?
Over the last 10 years, I've been able to maintain my weight at around 200. I gained weight, I lost weight. I used to be on a Weight Watchers diet. Right now, I just, I would say that my diet is more of a DASH diet, and vegan, if possible. Vegetarian. For vegetarian, I will do dairy products. I won't do meat.
Okay. Have you found that you're experiencing weight gain with fatigue or losses?
No.
Okay. What about with respect to any fevers? Have you experienced any of those?
I haven't had any. For over 10 years, I haven't had any fevers.
What type of rashes, with respect to your skin, have you noticed? Any rashes, lumps, sores, itching, dryness, color change, or change in your hair or nails?
No change. Well,
Okay.
my hair is thinned out. I can attribute that to my age. My skin is pretty much the same. I had a dermatology checkup a year ago, and they've done biopsies on moles that I've had, and they've been benign.
Okay. In terms of a podiatrist for diabetic foot care.
So I see a podiatrist about 3 or 4 times a year.
Okay.
For what do you call that? Diabetic wound care.
Yes.
Yeah.
So, if you were to describe having a diabetic wound care, where would it be?
So I have
Wound.
I have a callus on my right foot, under the ball of my foot, and the podiatrist is treating that to make sure that it doesn't open up and become an open sore. So far, it hasn't been an open sore, and my intention is to keep it that way.
So, what about your head? Do you experience, in terms of a review of systems for your head, do you have headaches, head injuries, dizziness, or vertigos?
I have my sense of balance has been affected by the diabetes. I have peripheral neuropathy, so I don't have any feeling in my feet, toes. But as far as my head, I haven't had anything other than the dizziness, which I've attributed to the diabetes. I haven't had any.
What type of vision, in terms of your eyes, have you experienced any changes in vision, eye pain?
No eye pain. Vision's been about the same.
Redness or swelling?
No.
Do you have corrective lenses?
I do, and it's like 20/20 in one eye and 20/25 in the other eye. I've actually haven't worn. I've broken my glasses and I haven't replaced them for about 10 years.
Okay, but you did say you had an eye exam recently.
Yeah, and The eye exam was the same. The result was the same. My eyes had not changed. The correction was the same as it was 10 years ago.
Okay. Are you planning to do follow-up on replacing your glasses?
Eventually. Not right at the moment, but eventually.
Okay. Have you experienced hearing challenges? Oh, I'm sorry, excessive tearing.
Tearing?
Yes.
No.
Double vision?
No.
Blurred vision?
No.
Scotoma?
What's that?
It would be where your scrotum is like inflamed or red.
Eyes?
Yes.
Oh. No.
Okay. What about, you do have corrective lenses as we've discussed, and you have another eye, you have when will your next eye exam be?
Probably in about a year.
Okay. Okay. In terms of your ears, have you experienced any hearing changes? Or have you experienced tinnitus?
Years ago, I've had tinnitus off and on for probably 20 years. It began when I was driving, and I was looking away from the highway, and I was looking at a farmhouse, and I hit a bump, and I could feel my neck give, and I've had tinnitus ever since then.
Mm. Thank you for sharing that. Do you have any complaints of earaches? Okay, so do you have any earaches, infections, discharge?
No.
Okay, hearing loss?
No.
Hearing aid use?
No.
Okay. What about nose, your nose or sinuses? Do you have frequent colds, congestion?
I haven't had a cold in years.
Okay, what about
But congestion, I will occasionally, my nose will get congested if I'm around something that has some irritant, dust particles. If I'm out in the grass, I will get hay fever. And I have some sinus tablets that I'll take, and I'll take those and it goes away.
Okay. So you take sinus tablets. Okay.
Yeah, occasionally.
Okay. And those are over the counter, correct?
Yes.
Okay. Do you have nosebleeds?
No.
You do have hay fever. You stated that you had hay fevers and allergies. Do you have change in smell or any sinus pain?
Sinus pain, no. Smell. Sometimes I smell well, other times I don't. And I have no idea what causes that. I'm tending to think that it has something to do with the diabetes, but I haven't really researched it. I can smell smoke, and that's important.
Thank you for sharing. In terms of bleeding gums, Have you experienced that when it comes to your throat or your mouth?
No.
Mouth pain?
No.
Toothache?
No.
Lesions in mouth or tongue?
No.
Do you wear dentures?
No.
When was your last dental exam or dentist exam?
Last year.
Okay. Do you have a sore tongue?
No.
Dry mouth?
No.
Sore throat?
No.
Hoarse throats?
No.
And you stated you did have a tonsillectomy.
Many, many, many years ago.
Okay. Do you have altered taste?
I don't quite understand that one. What would be an altered taste?
Like, well,
A craving for hot fudge sundae?
no, if you have a craving for, do you have any altered taste, meaning you unable to distinguish the difference between salty and sweet, sour
No.
or
No.
peppery?
No.
Okay. Do you have any lumps that you're aware of, such as enlarged or tender nodes?
Well, I have.
And this will be pertaining to the neck region.
Oh, no.
Swollen glands,
No.
goiter,
No.
neck pain in your neck,
No.
neck stiffness,
No.
limitation of motion. This is all in the neck now.
No.
No rigidity. Okay. Do you, in terms of the breast, we're doing this from head to toe, do you have any lumps,
No.
pain?
No.
No pain in your breast area, in the
No.
region of your breast. Discomfort?
No.
Nipple discharge?
No.
Any rashes?
No.
Surgeries?
No.
History of breast disease?
No.
Do you perform a self-breast exam?
No.
So, the mammograms do not apply to you?
I have not had a mammogram.
So, do you have any tenderness
No.
in your breast area, in the region of your breast area?
No.
Lumps?
No.
Swelling?
No.
Rash?
No.
Do you have any rash or swelling in the axilla area?
No.
Okay. With respect to your lungs now, do you have a cough? And if so, is it productive or non-productive?
No cough.
Do you have hemoptysis, which would be coughing up blood?
No.
Dyspnea, which is difficulty breathing?
No.
Wheezing?
No.
Pleuritic pains, that would be lung pains?
No.
Do you have any history of lung disease?
I had pneumonia many years ago.
Okay.
I was treated for that and it went away.
Okay. Do you have any history of toxin exposure?
Not to my knowledge.
Any chest x-ray?
Chest x-ray? I had one last year.
In the fall, summer, or spring?
Spring.
Did you have a TB skin test? Have you had one of those?
Not to my knowledge.
Okay. So now we're going to the heart. Do you have any present symptoms of pain or discomfort in your
In my heart?
heart area?
Heart area?
Heart.
No.
Okay. Any palpitations, meaning you feel your heart beating fast?
No. Any
dyspnea, which would be when you breathe in and out, you have difficulty breathing?
No.
Okay. Edema, which would be swelling or fluid on the lungs?
No.
Orthopnea. Orthopnea would mean that in order to breathe, you need to be sitting up.
No.
Cyanosis,
No.
which would be like bluish colors
No.
to your nail beds, your fingertips, your toes,
No.
because the blood, the oxygen isn't perfusing or going through your circulatory system
No.
adequately. Nocturia, that would mean at night you're getting up to urinate frequently.
No.
History of murmurs.
No.
Hypertension.
Mild hypertension.
So anything above 120/80 is hypertension.
Okay, so I would say pre-hypertension maybe it's like 120 to 135. Nothing over 90.
On the bottom
Right.
number, okay. Okay. Okay, what about anemia?
No.
Do you have a history of coronary artery disease?
Yes.
Okay. Do you have, we discussed that you did have a history of an MI, which stands for myocardial infarction, and is otherwise known as heart attack. And you did have you described having atrial fibrillation before.
Yes. I had atrial fibrillation one time during that same week when I had the stents put in.
Okay. Okay. And you also have diabetes, and you know diabetes can affect your heart.
Yep.
In addition.
Yeah.
Okay. In terms of your your gastrointestinal system,
Gastrointestinal.
have you noticed any change in your appetite?
No.
Any jaundice?
No.
That would be yellow eyes or yellow skin. Any
No.
nausea or
No.
vomiting?
No.
Any dysphagia, which would be difficulty swallowing?
No.
Any heartburn?
Occasionally, and I'll drink water and it'll go away. So I guess it's not really heartburn.
Okay.
Oh, acid reflux. I'm sorry, that's what that is.
Okay. What about dysphagia, which would be difficulty swallowing?
No.
We just discussed heartburn, and you said that wasn't applicable, but you did have acid reflux. At times, that was relieved by drinking water, and it would go away.
Yep.
What about pain in your gastrointestinal region? Any pain on swallowing?
No.
Do you experience belching or flatulence?
No.
Changes in bowel habits?
No.
Have you noticed any blood in your
Bowels? Urine?
anywhere
Vomiting? No.
in your
No blood.
coughing up blood?
No blood.
Any black stools?
No.
No melan. Any hemorrhoids?
No.
Constipation?
No.
Diarrhea?
No.
Food intolerance?
What would be an example of that? Food intolerance?
That's if you were to eat shrimp. Let's say that you were allergic to seafood and you ate shrimp and you had a terrible reaction to eating shrimp
Okay, ask the question again.
or food. Have you experienced any food intolerance or any changes in the types of food that you're eating?
No.
Okay. GU would be your urinary system. It's called the genitourinary system.
Okay.
Nocturia would be going to the bathroom at night.
I would say not unusually, frequently.
Okay. Do you have urinary urgency? Meaning you gotta go, you gotta go, you gotta go.
Yeah, when I get a full bladder, then I have to go. Yeah.
Okay. Dysuria would be difficulty urinating.
No.
Hematuria would be blood in your urine.
No.
Incontinence would
No.
be wetting your pants.
No.
Okay. We'll skip the female section and
Not applicable.
correct. With respect to your urinary stream, have you experienced any of the following? Urinary hesitancy,
No.
dribbling,
No.
urinary dribbling.
No.
Have you had a hernia?
No.
In terms of your sexual habits and interests, function, and satisfaction, have you experienced discharge from sores or your penis?
No.
Have you had HIV exposure?
No.
Testicular pain or masses?
No.
You have you had a testicular exam? And if you have, how often?
A testicular exam, 2017.
And 2000. And have you had one recently, like 2018 or 19, on recommendation from your primary physician?
I may have. I was referred to a urologist and he did a complete exam.
Okay. So that would possibly...
PSA was elevated. This was 2017, so he did a rectal exam and biopsies, and it came back with mild cancer, early stage cancer, slow acting early stage cancer.
Okay. And that was when you were in the county that you now live in?
No, actually that was in Baltimore County.
Okay.
When we were living in Baltimore.
You and your wife. Okay. So you haven't had...
When I was living in Baltimore.
Okay.
Yes, ma'am.
Yes, sir. Okay. Now, we're going to be talking about your peripheral vascular systems. That's how the blood flows to your extremities.
Okay.
So, have you experienced any coldness, tingling, or numbness in your legs or your digits?
In my legs, in my lower legs, and in my feet. After I got diabetes, and the doctor said that was peripheral neuropathy.
Okay. So.
And that was something I was going to experience the rest of my life, or until diabetes went away.
Okay. So, are you working on becoming diabetic free? Is that?
Well, I'm trying to mitigate the effect of diabetes. Losing weight is one of them. Limiting the amount of sugar that I take in is another. Trying to keep the sugar level reasonably low.
Okay. So, have you had any history of blood clots, varicose veins, any history of leg cramps? Let's begin there.
Leg cramps? No. I get occasional leg cramps, and I'll drink water and it goes away.
Mm-hmm.
I get leg cramps more often if I have a short night's sleep.
Okay. What about history of blood clots, discoloration of hands?
Well, the blood clots I had in 2013, and that's when they discovered that I had. I needed to have 2 stents put in my heart. So I don't know if that was caused by clots or what, but narrowing of arteries.
Okay, I will review your charts to see. Well, if you have blood clots in your peripheral vascular area, it can make your cause the circulation to your extremities to become discolored because the blood isn't reaching.
I haven't had any of that.
Okay.
And the recent.
And note, you haven't had any discoloration of hands or ulcers. I'm sorry I interrupted you.
No, that's fine. No, the answer's no.
Okay. All right. We are now going to go to the musculoskeletal system. Do you have any muscle, joint pain, or cramps?
No.
Any joint stiffness?
No.
History of arthritis or gout?
No.
Any limitations of movement or any limitation of movement?
Oh, I would say with my lower back, there's some limitation. Pretty much beyond that, no. I wear a back brace.
And we discussed the history of disc disease.
Right.
What about pertinent negatives? I'm sorry, that's correct. What about, so now we're going to talk about neurological. That would be if you had any history of syncope, which is fainting,
No.
seizures,
No.
weakness,
No.
paralysis,
No.
stroke,
No.
numbness, or tingling.
Just the peripheral neuropathy.
Okay. Any tremors or tics?
No.
Involuntary movements?
No.
Coordination problem?
It's slight imbalance from the disease, from diabetes. just have to watch where I walk.
Okay. What about memory disorders?
No.
Mood changes?
No.
History of mental disorders?
No. None.
History of hallucinations?
No. Not yet. Yes.
Okay. Do you have history of anemia?
No.
Easy bruising or bleeding?
No.
Any blood transfusions or reactions?
Never had a blood transfusion.
Any lymph node or swelling?
No.
Exposure to toxic agents or radiation?
Radiation, but just the when I've had the X-rays and the MRIs and stuff.
Okay. In terms of your endocrine system,
Okay.
have you had any heat or cold intolerance?
No.
Excessive sweating?
No.
Polydipsia, which would be excessive thirst?
No.
Polyphasia, which is excessive eating?
No.
Polyuria, which is excessive urination?
No.
Has your glove or shoe size
Changed?
yes.
No.
All right. Do you have a history of diabetes?
Yes.
Any thyroid disease?
Not that I'm aware of.
Any hormone replacement?
No.
Any abnormal hair distribution?
No.
We are now going to do the psychiatric portion.
Not applicable.
Do you have any nervousness or anxiety?
No.
Any depression?
No.
Any memory changes?
No.
Any thoughts of suicidal ideation
No.
or suicidal attempts?
No.
Any history of mental illness?
No.
Thank you for
That it?
being, for providing subjective information in your history interview, and I am now concluding this session. Do you have any questions or any?
None.
Okay.
I'm good.
Okay. If you need it, if you think of anything or you'd like to review some of the things that we've said and you'd like to, talk to me about it, feel free to call, and if it's after hours, the switchboard will get in
Excellent.
touch with me.
Okay.
Thank you.
Very good. You're welcome. Thank you.